Hello, my name is Vladimir Zuev. I'm a doctor of obstetrics and gynecology, professor of the Obstetrics and Gynecology department at the First Medical University of Moscow. Today I want to talk about women's infertility. Infertility is a matter of concern to people all over the world because it destroys families and affects the national demographic policy. Therefore, it's an important problem from all points of view. This situation motivates doctors, sociologists, and other specialists to look into its causes in an attempt to resolve the issue. How can we do it? Currently, there are many methods of diagnosing and treating women's infertility. Yet today, I would like to discuss the infertility caused by functional incompetence of the uterus and its inner lining, the endometrium. The crux of the matter is that the success of pregnancy is dependent on the possibility of implantation, the invasion of the embryo into the mucous membrane of the uterus, which is quite a complicated process. People and doctors all over the world are striving to find such an implantation window to facilitate the preparation for an initiation of pregnancy. Many infertile couples visit the reproductive clinics to take advantage of complementary reproductive techniques, which have improved the situation substantially. These technologies involve primarily the extracorporeal fertilization and the embryo transfer. Well, seems to be simple enough. To take the biological material, combine it, and transfer into the uterus, and, so it would seem, the pregnancy should start and progress. However, it doesn't always happen like that. The truth is, today, in vitro fertilization, IVF, and embryo transfer are successfully achieved only in every third couple, i.e. in 1 out of 3 women. And to a great extent, it is due to the functional inability of the endometrium. There are several ways of evaluating the condition of endometrium and its viability. Well, for the most part, these are traditional methods: ultrasound examination, Doppler ultrasonography, hysteroscopy, and morphological investigation in the form of immunohistochemical analysis. It would seem that this should be sufficient, and yet sometimes it is not. So, what have we done? We have developed our own method and have been using it for over 10 years. It is a spectral diagnosis that enables prompt online evaluation of the state of uterus mucous lining, its morphological and functional condition. The technique is simple, non-invasive, and it allows us to say in just 10 to 15 seconds, yes, in this case, the probability of successful pregnancy is high. Or, to the contrary, in a given situation, pregnancy can't be initiated because the mucous membrane is not adequately prepared. I've been using the methods of laser spectroscopy for more than 10 years. During this time, more than 5,000 examinations have been conducted, and we have helped our patients in over half of the cases. It means that as many as 64% of patients who had repeatedly undergone embryo transfer had gone through the IVF programs and still failed to conceive, had successful implantation after the spectral diagnosis and appropriate treatment. In other words, we were able to improve the effectiveness of IVF and embryo transfer from 0% to 64%. Laser spectroscopy is a unique method of diagnosing the functional state of the endometrium. None of the alternatives make it possible to evaluate in 3 to 5 seconds the readiness of the endometrium to interact with the fertilized ovum. Laser spectroscopy provides the opportunity to prognose the successful course of pregnancy not only in its first trimester, but also over its full duration. In practice, we carry out laser spectroscopy with the help of the instrument Photon-Bio, engineered by our colleagues physicists, who provided us with an excellent opportunity to tackle the problem of treating infertility in women. One of the essential requirements for introducing an embryo into the uterus cavity is its sufficient oxygen content, which is very difficult to determine by other methods. Evaluation of relative cell division in different areas of the endometrium in the uterus cavity allows us to presume the possible level of endometrium susceptibility to implantation. Employing laser spectroscopy, we can also estimate the intensity of metabolism, which is crucial for understanding whether the endometrium is well prepared for the implantation. To our knowledge, nowadays, the alternative technologies capable of producing nearly instant results of such measurements practically do not exist. The given approach enables prognosis of the possibility of pregnancy commencement, of its course, and likely complications over its full duration. Therefore, we believe that it is a very important, very useful, and very needful method of diagnostics and monitoring of the endometrium treatment in its preparation for pregnancy. With the aid of laser spectroscopy, it is possible to establish the appropriate time for the effective embryo transfer resulting in successful pregnancy. Or, to the contrary, to recognize the impossibility of the embryo transfer when it is evident that the endometrium is not ready to receive the embryo at the time. After exposing the uterine cavity with the speculum, we insert the fiber optic probe with a protective cap through the cervical canal into the uterine cavity, reaching its bottom, where we take two measurements, using the laser radiation and the white light. Next, the probe is moved back, approximately to the center of the uterine cavity, where we take the next two measurements, with the laser radiation and the white light. The third set of data is collected in the area of the internal orifice of the uterus. Also, two parameters are measured, with laser radiation and white light. Finally, the probe is withdrawn and the procedure of laser spectroscopy is finished by measuring the spectrum of the skin on the surface of the inner thigh. The examination takes 10 to 15 seconds. The resultant data are displayed in the computer program shown here. The data for oxygenation, proliferation, and structural organization are presented here. Clearly, in the case of this patient, there is a marked derangement of oxygenation, deficient proliferation activity of the cells, and lack of structural organization. It means the data from different parts of the uterus are varied. Here, the graphical representation of the measurement results is shown. We can see the spectral plots of oxygenation, proliferation, and structuredness, optical measurement, and laser radiation. The situation at the time of another visit of this patient is reflected in the following chart, which was recorded in the process of the treatment. Here we see the dynamics of obtained results. the dynamics of changes in oxygen content of the tissue, the dynamics of developing proliferative activity, and the dynamics in the structural organization. The graphic rendering is presented in the given spectrogram. Traditional, classic methods of diagnosing the state of the endometrium are hysteroscopy, biopsy, and morphological study. Recently, it's been a frequent practice to use the immunohistochemical analysis. It must be said that all these methods are quite effective, although each one has a downside. For instance, none of these techniques provide information about the functional state of the endometrium, how well it is oxygenated, how viable it is. It means that each of these methods is effective on its own merit, and on the whole forms a particular picture. However, it doesn't reflect the functional, vital state of the endometrium, the very dominant characteristic that determines its viability. Doctors and patients often assess the susceptibility of the endometrium to implantation based on its thickness. Nonetheless, even its thickness, the endometrial echo determined during the ultrasound examination, doesn't indicate the tissue vitality. It is estimated primarily according to the oxygen content. It is the absence or deficiency of oxygen, called hypoxia, that's very often the principal cause of endometrium's inability to receive the fertilized ovum. The ultrasound study and Doppler ultrasonography determine first of all the present state of capillaries and blood vessels and the characteristics of the vascular blood flow, but they can never estimate how much oxygen is transferred from the vascular bed into the tissue and how much oxygen tissue contains. This information can be obtained only from laser spectroscopy. Programmable laser complex Photon-Bio provides information that is impossible to obtain with ultrasound examination, and it is considerably less expensive compared to any ultrasound machine.